Joining me now is the Federal Health Minister, Patty Hajdu. Minister Hajdu, joining us from Thunder Bay. Thanks for taking time.
Nice to talk with you again, Martin.
Okay, there's two big subjects I want to get to this week. One of them is the motion that's going to be voted on Monday. But first, let's talk about what's coming up today. And this is a bit of a dispute about rapid tests, which are starting to arrive in the country. We know that the government's ordered millions of them. The first shipment of 100,000 arrived last weekend or early this week. But all 100,000 of those rapid 15-minute tests have gone to Ontario. François Legault, the Premier of Quebec, is not happy about that. On what basis are these decisions being made about where these tests go?
So these are decisions that are worked out through the various technical and special advisory tables, as well as with the deputy health ministers with all provinces and territories. As the Premier knows, there will be tests arriving in Quebec next week. And in fact, we've been there supporting provinces and territories through shared agreements all along. In fact, all of the work that we've done has been through collaboration and agreements that really kind of clearly underline principles that ensure that people get what they need per capita, and that the federal government is able to hold back a small amount in reserve, whether we're talking about tests or PPE, so that we can respond to areas of critical need.
So the next ones would go to Quebec. Quebec could expect them for when, next week?
I don't have the delivery schedule, memorized, Martin. But all this to say that provinces and territories are active participants in the delivery schedule. Of course, we've worked with all the provinces and territories to make sure that they have what they need from a surplus perspective as well, a surge perspective. I'll just point to the rapid response program, where provinces and territories can ask for assistance, and we're able to deliver additional supports, including testing capacity, contact tracers, supports in long-term care homes, and we've continued to do that. But I just want to thank the provinces and territories for working out these agreements that really help ensure that the product gets to the right place at the right time.
Okay, so just in a nutshell, the priority, the factors that make priority, who are the priority groups who are going to receive these tests, or where will they be used?
Again, provincially determined. I think it's really important that people remember that healthcare is primarily in the jurisdiction of provinces and territories to deliver. So the federal government is not telling provinces and territories how to distribute testing, how to distribute PPE, but rather facilitating the acquisition of these goods, and then allowing provinces and territories within their jurisdictional rights to be able to determine how to use them. But typically, what I would say is rapid tests have been used in populations where people are symptomatic, where there are congregate living settings like long-term care homes, sometimes in populations like remote and rural communities. Those can be really great places to put a rapid testing capacity in place, so that you can very quickly determine if someone who is symptomatic, in fact, is sick with COVID or with something else.
Okay, now let's get to, and this will come up as well, it's connected. It's been one of the issues that's been raised in the House of Commons every day in question period. And we saw yesterday the tabling of the Conservative motion. I just want to confirm with you before we go any further, the motion that's going to be voted on Monday is not a confidence motion. This motion to produce documents concerning the government's COVID-19 response is still not going to be a confidence motion as we speak?
I don't have determination over which votes are confidence and motions or not. That's within the purview of the Prime Minister and the House Leader. But, listen, I've been clear with the House Leader that Health Canada and the Public Health Agency of Canada can comply with the motion if it's reasonable, and if the length of time that's within the motion to produce those documents is within a reasonable time frame. My concern has always been, as the health minister, I don't want to pull people off of the response to COVID-19 to produce documents in an extraordinarily short period of time. Let's not forget, we're talking about thousands and thousands of documents, and I think Canadians expect us, obviously, besides being transparent with Canadians, to keep focused on the kinds of activities that are working to support provinces and territories, like we just talked about. For example, approving and procuring tests.
So for you, I mean, but just to be clear, so far to date, we haven't had any indication that this is going to be a confidence motion. All of the indication from the PMO and your colleagues has been that this will not be a confidence motion. So for you, the issue is negotiating the time frame. It's not a question of what documents would be made available?
No, listen, I think, obviously there are some documents that are sensitive. There are procurement contracts that are in place that require a certain degree of confidentiality. And I know my colleague, the Minister of Procurement, is working on that issue as we speak. But the intent, from my perspective, is to be fully transparent, as we have been, Martin, all along. I think, the piece of the motion that I would just say implies that there's been a lack of transparency is completely incorrect. I mean, we've appeared in front of the Health Committee numbers of times. Me, myself, I've gone at least 2 or 3 times in front of the Health Committee. Dr. Tam, Dr. New, many other officials. We've produced documents. We've provided updates to the Health Committee and other committees as they're relevant, and we'll continue to do that. Again, the concern I had with the motion as it was written was this very short period of time to be able to produce thousands and thousands of documents. As in fact, my colleague, the member opposite to the sponsor of the motion yesterday, implied that I should pull people off of other duties to put them into information officer types of roles in order to achieve that goal. And I would disagree with her. I would say that Canadians would expect that we produce, obviously, the documents requested, but that we also stay focused on what matters most to them, which is making sure that their health systems have the supports they need so they can stay healthy and free of COVID-19.
So you foresee, though, being able to, when the House passes this, because it's going to be voted in favor of by the NDP, the Bloc, and the Conservatives, when the House passes this motion, you are confident that you will be able to comply or to respond to this request for documentation?
Listen, should the House pass the motion, and I never presume what the House will do until the House has voted, but should the House pass the motion, absolutely we'll do the work that's necessary in order to produce documents for the HESA committee so they can study the response to date. And I will take the member at her word that what the intent of that study is to inform the government's next steps and to provide recommendations to the government. So I look forward to that work with the HESA committee. And again, I remain focused on making sure that both departments have the resources and their resources trained in the right space so that they can make sure we protect Canadians from COVID-19.
Okay, Minister Hajdu, I want to thank you very much for taking the time. Thanks for speaking with us.
Thank you very much, Martin.